because sometimes it's surprising that someone else might have exactly what you have, or at least have the same symptoms, and you can recognize yourself in others. Often we can't see what's ailing us, but we could see what's in somebody else. All right, well, I'm Frank, and I am a counselor at the Dual Diagnosis Treatment here at Clear Behavioral Health in Los Angeles, California. Here at Dual Diagnosis, we treat addiction and mental health as a comprehensive issue. So when you come here, you're not only being treated just for the substance abuse, but also for your underlying mental health issues, which can be anxiety, depression, PTSD, many that may lead to your desire to actually treat yourself with a substance rather than finding a healthier coping skill. Many counselors can be certified, so it can be an LADC, a licensed alcohol drug counselor, or an LPCC as well. But those certifications will ensure that you're trained and well-versed in both. But it's also important that you are specifically talented in individual counseling and being able to run a group. And have group sessions, be dynamic and supportive, whether people are alone or within the entire group. I think when you're dealing with people who are suffering from addiction and mental health, it really helps to be within a group and to be with people who are suffering similar things. Many of our clients get to watch others develop and get better over time, and also have their progress be reflected from others. So the group setting is really one of the most important settings, especially for substance use disorder. And when you get a bunch of brains in a room, they tend to just start vibrating at the same level, and one helps the other. So that's imperative, because sometimes it's surprising that someone else might have exactly what you have, or at least have the same symptoms, and you can recognize yourself in others. Often we can't see what's ailing us, but we could see what's in somebody else, and that leads to a lot of recovery. So the group setting is really imperative for people who have the co-occurring disorders of mental health and substance use disorder. I think within the group as well, there's as we're pack animals and we need to be together, we're social, the safety within the group is really one of the biggest things, I think. So the group counseling setting allows for the leader to sort of coordinate certain things, but really allow the group to heal the individual members. So individual counseling is so important because it's something where it's one-on-one, and when you build that rapport there, you'll say certain things that you may not say in the group. But when you're able to say those things in the group counseling setting, you really benefit from the entire group supporting you. I would say that, like anything else, you should look around. You should find someone who you really connect with, who you trust, and for whatever reason you start to realize you have something inside that feels safe to come out with certain people. You shouldn't feel pressured, and you should search for someone who is credentialed, licensed, and HIPAA compliant. One of the biggest things in recovery and in substance use recovery and mental health treatment is the rapport. So in individual counseling, you're really going to want to find that safety for somebody to be open, honest, and willing to explore some of the things that are causing or at least adding to the disorder. So such as family dynamics are a big thing. So you really want to feel safe there. As a counselor, I find it imperative that I speak and get the insight from the family. And once I get that insight, I can get new leads on how to speak to them, because sometimes it really helps for them to understand some of the symptoms, some of the triggers, some of the things they'll see in a dual diagnosis patient. So the substance abuse may be very obvious to the family, but they may not be completely aware of the dual diagnosis situation. Often mental health disorders go either unnoticed or even blamed. because you can't see it. You can see the substance use disorder, but you can't see the mental health disorder. So if somebody is suffering from something that may be a trauma response or even PTSD, something greater like that, or any of those really, it's important for the family to understand what that patient is going through. I think what's really special here at Clear is, obviously everyone's being paid, but no one can be paid to care. And what I've witnessed here is from the top to I don't want to say the bottom, but just in all aspects, everybody really cares and goes the extra mile here. Most of the people here have been through things themselves, and that they've made a decision to seek to help and create a worthwhile life for themselves while trying to provide the skills and the services for others to have that in their lives too. And I think that's really special here. It just doesn't feel that way other places, and you're going to get the type of treatment that's going to make you feel like you've done something really great for yourself and that you'll be able to have the life that you wanted.